President Trump has threatened to withdraw funding from the World Health Organization, accusing it of mismanaging the coronavirus pandemic, particularly in its early stages as it emerged in China. We've been looking at some of the charges President Trump has leveled against the WHO and the health body's responses. Claim 1. The WHO failed to adequately obtain, vet and share information in a timely and transparent fashion. This has become a regular theme of Mr. Trump's criticism of the WHO, and in his letter to its head Dr. Tedros Adhanom Ghebreyesus on the 18th of May, he renewed this attack saying the WHO consistently ignored credible reports of the virus spreading in Wuhan in early December 2019 or even earlier. Mr. Trump specifically highlighted reporting by the Lancet medical journal. The editor of The Lancet, Richard Horton, has written a letter in response, saying, "The Lancet did not publish any report in early December 2019 about a virus spreading in Wuhan. The first reports we published were from Chinese scientists on January 24, 2020. In response to the criticisms leveled at it, the WHO says it acted properly in accordance with the information it was given by China, sharing it with medical and scientific experts around the world, including from the US. The WHO says it was told by China of a pneumonia of an unknown cause on the 31st of December 2019. Then, on the 5th of January, the WHO put out an official statement saying it had asked for more information about the illness from the Chinese authorities. On the 12th of January, China publicly shared the genetic sequence for the new coronavirus. Timeline of the outbreak in China. On 20 and the 21st of January, a regional WHO team visited Wuhan. A public statement was issued by the WHO on the 22nd of January setting out what they had discovered. On the 28th of January, Dr. Tedros went to Beijing to discuss the outbreak with China's leaders. By the end of January, the WHO had declared the outbreak a public health emergency of global concern. It has also been reported that WHO experts, drawn from 15 countries including China, met a week earlier to discuss whether to issue a global alert but could not agree among themselves. Claim 2. Through the middle of January, it parroted the idea that there was no human-to-human transmission happening despite clear evidence to the contrary. President Trump identifies a critical few days here when the messaging from the WHO was evolving rapidly. On the 14th of January, the WHO tweeted, "Preliminary investigations conducted by the Chinese authorities have found no clear evidence of human-to-human transmission." But the same day, the head of the WHO's Emerging Diseases Unit, Maria van Kerkhove, appeared to contradict this, suggesting to journalists that limited human-to-human transmission had been observed in Wuhan. She did however stress that there was no clear evidence of sustained transmission between people. It wasn't until the 22nd of January that the WHO confirmed there was clear evidence of human-to-human transmission in Wuhan. The WHO has denied media reports that it delayed making this evidence public at China's request. Claim 3. The WHO has an alarming lack of independence from China. In his recent letter to the head of the WHO, Mr. Trump accuses the organization of being too close to China, failing to remain objective in its handling of the outbreak. It's certainly the case that the WHO has publicly praised China's response to the coronavirus outbreak and its commitment to transparency, something that has clearly angered the US president in recent weeks. However, many other experts and political leaders, including Mr. Trump, have also praised China's initial response to the outbreak. On the 24th of January, Mr. Trump was effusive in his support for China's efforts. Dr. Michael Ryan, of the WHO, says the organization wanted to keep the lines of communication open with China as it battled to contain the virus. The WHO has also been accused of being unduly influenced by Beijing over the status of Taiwan. The issue here is that Taiwan is not a member of the WHO, as the island is not recognized by the UN. The WHO, however, says it does engage with Taiwan and share information with it. Taiwan says it raised the alarm about the possible human-to-human spread of the virus at the end of December after some of its scientists had visited Wuhan. Taiwan says its warnings were ignored or not taken seriously. But the evidence published so far shows Taiwan's exchanges with the WHO did not specifically mention human-to-human transmission. Claim 4, one of the most dangerous decisions from the WHO was to oppose travel restrictions. They actually fought us. The US restricted travel from China and other countries from the 2nd of February. But there is no record of the WHO publicly criticizing this move. And it would have been highly unusual for it to do so. But it had, on the 10th of January, put out advice recommending no international travel restrictions in response to the virus. And this was reconfirmed in a statement at the end of February, saying travel bans were not usually that effective and could have an adverse social and economic impact, although they might be justified for a short period of time at the start of an outbreak.